We need to teach our physician leaders non-clinical competencies, and we do that best by shared leadership. And that's where ACC and Mid-Axiom come in. It's what I call the totem pole theory of management. And that's to remember that we stand on the shoulders of giants.
I know sometimes it's hard to brag on yourself, but why you? What were you doing in that moment that really made you someone that they knew would be great in this leadership role?
When it comes to cardiovascular care on the organizational level, Mid-Axiom understands the challenges your program is facing. Welcome to Mid-Axiom HeartTalk, the podcast where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. Mid-Axiom HeartTalk starts now.
I'm Melanie Lawson, a journalist in Jacksonville, Florida, and host of Mid-Axiom HeartTalk. In April of 2024, Cathie Biga made history as the first non-physician president of the American College of Cardiology. With more than 40 years of experience in healthcare, she has held a number of roles as a leader in cardiovascular care. A longtime leader of the ACC and Mid-Axiom, Cathie is committed to enhancing patient care and outcomes. Her role in fostering a culture of collaboration among healthcare professionals inspires us all. Cathie, we are thrilled to have you join us on the podcast today. Thank you so much for taking some time out for us.
Hey, Melanie, it's my honor. As you know, Mid-Axiom is where I grew up, so it's a pleasure to be here with you.
Well, everyone knows you, and everyone I talk to loves you. So let's dive right in to hear about just your journey in healthcare and the impact that you certainly have had in cardiovascular care. So your leadership journey, we said it's worth restating, spans more than 40 years in healthcare, from the bedside as a registered nurse to years of leadership as an administrator, and now ACC president. What a journey you've had.
Yeah, I am so extremely fortunate. It has been a remarkable time. You say 40 years, it makes me feel very old, but it's amazing the opportunities that I've had. But I'd be remiss if I didn't recognize that nobody does those journeys on their own. The journeys really are a village. It takes a village to help us get us where we want to go, where we don't even think we want to go, and we actually get there. So that's what I think has been so remarkable about my journey, is the incredible varied pathways that I took. And so the one thing that's probably important for our audiences to know is to recognize that you never know where your journey is going to take you. So never be afraid to talk, never be afraid to explore something totally out of your comfort zone. It's so important to us to not be limited by what we think might limit us. So it's amazing. If you'd ever told me 40 years ago, as you say, that I would have lived this past year, I would have told you were nuts.
Wow. And I mean, walking through doors that you didn't even know were available to you. So it certainly is significant. Well, Cathie, you've been a Heart Talk guest many times, but for those who have not heard your full story, why did you decide to get into healthcare? And honestly, after all these years, what fuels you to keep going every day and truly innovating?
Yeah, and I think I'll probably start with what keeps me going, because I think that's probably most important, especially for our younger individuals that are just entering healthcare. You have to make sure you have a passion for it. And it is something that, unfortunately, as my grandkids tell me all the time, I just can't retire. I keep thinking I'm going to retire, but it just doesn't happen. And so having passion for what you do, I think, is probably the most critical message that we can deliver. And as you've said, 40 years seems like, oh my gosh, who would have ever anticipated doing this? Because honestly, if you go back, it's actually more than 40 years, so don't tell anybody. But you kind of go back to that time in history, and honestly, women were nurses or teachers.
Yeah.
That's kind of where it was at. And I'll never forget, my dad said to me, well, why don't you be a physician? Because my brother was going to be a physician. And I'm like, no, not really what I want to do. And actually back then was just when bachelor degree nurses were just becoming heard of. It was always a 3-year component in our journeys. And I loved being a nurse. Now, to be completely honest, if I wasn't in the critical care unit, it was not a good day. I loved the chaos. I loved the activity. I loved the patients that were in critical care. So my years in critical care really, I think, laid the infrastructure both for my message of teamwork as well as my focus on quality that has hopefully followed me throughout my career. And then, as everybody, there was a journey. I decided to get my master's degree, but if you notice, my master's degree is in nursing. And again, I'm going to date myself for all of you out there, but I was going to be a clinical nurse specialist. People today go, what in the world is that? So that was the beginning of our advanced practice nurses, our APNs. And so that was what my background was in clinical nurse specialty. And I went into a non-traditional role as soon as I got my master's degree. And that probably set the stage for me to just do something different. I was actually working in pre-admission. This was back in the days where we were just starting to move critically ill patients to their home. And then I'll never forget August 13th, 8 months after I had gotten my master's degree, the hospital CEO called me and asked if I would run their units. And I'm like, huh? What? What?
Wow.
I don't even know what that means. I don't know what an FTE is. I haven't got one finance course under my belt. But what the heck? I loved critical care. Was really missing it as I was out in the ambulatory world. And so that sort of started my pathway. And then again, that message to our audience is never stop talking, never stop connecting, never stop networking. And that's where MedAxiom came in, because that's when MedAxiom started. I'll never forget my colleagues, Joe Butts and Greg Timmers. They were individuals that ran practices in Illinois. And they said, you really need to join this thing called MedAxiom. And I'm like, what? What's MedAxiom? I was group 30. We're all very proud of our group numbers. I think Greg Timmers might have been group 1. I can't remember how we all played in that sandbox, but that's what really started my administrative journey, was with the MedAxiom team. And it's just been a pleasure, moving from the bedside into management and administration, becoming a hospital CEO, which is a unique skill set that honestly, I'm glad I did it, but wouldn't want to do it again. Being with the physicians on the practice side of medicine, growing up with MedAxiom, being on the cutting edge, which MedAxiom brings to us every single day, and then slowly getting involved in the college. It was back then that physicians weren't necessarily welcome in the college until Dr. Jim Dove really sort of opened that door for us. So that's the amazing part of that journey, just always sort of being in the background with our physician leaders, trying to deliver care in a way that really made a difference to our patients. And then, what can I say? This incredible journey that I've been on this last year has just been remarkable.
I want to circle back because I think if you're listening and you first got that opportunity to run the department and you're like, why me? I know sometimes it's hard to brag on yourself, but why you? What were you doing in that moment that really made you someone that they knew would be great in this leadership role?
That's a very interesting question that I have not been asked before. And I probably won't take that example because I'd have to really think about it. But I'll take the example when the individual called me to offer me the hospital CEO role. And that I just remember vividly. Because back when I was in my director and VP role, I was still on the floors. I was still in the unit. I could still go to the cath lab and get my high from working with our patients in the cath lab. But when I turned him down and said, I can't be a hospital CEO, I've not got one finance component to my toolkit. I didn't take one finance course. I took physical assessment, for crying out loud. No, I can't be a hospital CEO. And he said to me, and I still remember this to this day, he said, Biga, I have 10 men that would clamor for this job. They're willing to fly across the country. I'm asking you to drive 10 minutes from your house to run my hospital. How can you say no?
Wow.
I'm like, I don't know. How could I say no? So I didn't. But to answer your question, I think then he had to call and rescind the offer, which was an interesting, fun story, because he forgot that I needed to interview with the board.
Oh.
The board really hires their CEOs. So that created an interesting chain, because then I was asked a question. And again, back then, you've got to take your brains back to 1990, thereabouts, 97, whatever it was. And the president, the chairman of the board, said to me, how can you run a hospital? you have got no finance background. What in the world are you thinking?
Right.
And this, I think, became my leadership mantra is I don't need to run this alone. I need to hire the smartest CFO that exists. He'll run the finances. I know operations hands down. I can run operations easily, and strategy will do together.
Yeah.
Must have been the right answer because they hired me.
Wow. I mean, it goes back to your initial comment about the team and the people who you surrounded yourself with. You've made wise choices.
Yeah, and I think the other thing, and we say this at MedAxiom all the time, and I say it now at ACC, there's a couple key things. Number one, my my management style, I like to hope my leadership style is not one of those book things that we learn about in school. It's what I call the totem pole theory of management. And that's to remember that we stand on the shoulders of giants. So every step of my career has been because people have supported me. And I may be at the top of that totem pole, but the reality is that there's all those other individuals that really help me to get where I'm at. And so we have to remember that. We have to remember the people that help us. And then the other thing we have to remember is that we absolutely have to hire people smarter than us. And every single time we hire somebody, hire to your weaknesses, because that's where your team will develop from. And I think that's what will make you a successful leader.
Yeah. What great advice and insight here. Appreciate that. Let's kind of take a look at something you said at a recent Heart Talk discussion. You said delivering cardiovascular care is a team sport. We need our team. So you touched on that just minutes ago, but again, explain why you do feel so passionate about shared leadership and teamwork across clinical and administrative roles as well.
Yeah, and I think I learned dyad leadership from some of our original colleagues and such that that we've got with us, and that would be Dr. Jim Dove and Greg Timmers were probably some of the first leaders that I worked with, and I said this to my physician colleagues when I started in this role is we come at it with different skill sets. Now, having nursing as a background has been a huge help. But the reality is using that shared leadership role, I think carries all of our teams so much further. And why teams? I think that also has evolved. And I think ACC is a good example of how teams have really evolved in being welcomed into the professional home and such. And it's all about utilizing each other's skill sets, utilizing that top of your license, so to speak. And I think we're much more powerful together as a team, and we don't have the resources. We don't have enough physicians, enough nurses, enough dietitians, enough pharmacists. So together is what we really need for our teams in order to deliver care, because the baby boomers continue to get more and more as they age and enter into our healthcare system. So access, as all of us in MedAxiom know, has become a huge issue in our offices. And so we have to, in my opinion, we have to approach it as a team. I think Ginger does a great job as she, traverses the country and actually the globe, because that's the other thing is as we look internationally, we are very fortunate in the United States to have the type of team that we can put together, and sharing that with our international colleagues is really, really important. And I think some of the MedAxiom projects that we've been doing, the one in China with the cardiometabolic clinics, all those are so important as we evolve in team-based care, because we talk about transforming care, but we haven't quite gotten there yet. And that's where ACC and MedAxiom come in. I think that's where these non-clinical competencies need to come into play. We need to teach our physician leaders non-clinical competencies, and we do that best by shared leadership. And I think you see that in your Heart Talks. As I listen to your Heart Talks, you often have the two together.
Yep.
And you get much further along as we go through it.
Yeah, it's really the secret sauce. It's almost like finishing each other's sentences too. One person says, yes, agreed, and then can punctuate that with more information and different perspective. You recently contributed to a cardiology magazine article examining the landscape of CV care. So a snapshot of what you said: cardiovascular medicine is at a crossroads, navigating the dual pressures of an aging population and an evolving healthcare landscape. The business of cardiology in particular is being reshaped by a myriad of cultural and technological trends. So how can organizations like the ACC and MedAxiom continue to address some of these challenges and really capitalize on the opportunities that are out there like technology?
Well, it's funny, that article was a little bit ago, but think about our environment today.
Mm.
And I think it, as if I may have said that just yesterday.
Yes.
So I think this is probably an important inflection point for all of us to realize that we cannot control the environment. We can't always control the chaos that's around us, but our superpowers, I think, as you just alluded to, our secret sauce is our agility and our adaptability that we have to respond to these environmental pressures or wherever they are and however they come at us. And there's certainly a lot of them right now as we sort of look what's swirling around us, from Washington all the way into our local communities and how we deliver healthcare. So that agility and adaptability, that's what we need to count on. That's what our leaders need to lead us through these evolutionary changes. And I think that's where MedAxiom and ACC really come into play, is to ensure that we continue to give people the tools that they need. We can talk about agility and adaptability, and honestly, it's no different. I used this example just the other day when I was up talking to the Alaska team, is oftentimes the cath lab will get crazy, the emergency room will get crazy. And when you see certain individuals walk in the room, it's just like calm descends upon the world, and we treat that patient, we adapt to that environment. The same is true for all of us. We simply need to learn to be agile and never take our eyes off our true north. If we keep our true north working as a team, no matter what the situation, we will be successful in caring for our patients.
Yeah, and I hear you also saying, why make the same mistakes twice? When we have this team, they can say, oh, no, don't go down that road. Been there, done that. And so you're learning from each other constantly and sharing that information.
Yeah. And I think allowing our teams to fail, that's
Mm.
another critical skill that we need to embrace. Now, we don't want to repeat it, obviously, but if as leaders, we review our failures and we learn from them, what a powerful message that is for our teams, because it will enable them, it will empower them to try things differently. Because if we don't have a safe environment, they're not going to try to deliver care differently. So we do have to try different ways that may or may not work in our communities. MedAxiom is probably famous for saying, when you've seen one X, one comp plan, one strategic plan, one care delivery plan, you've seen one. And the key to that is that we must adapt to our environment, whether we're rural or academia or urban. It all is a matter of how that team is going to function with that patient population. So very important to us. And I think words of wisdom for us all to learn to function with.
Yeah. All right. Well, this is an excellent place to pause for a quick message for our Heart Talk listeners. You hear the term care transformation a lot, but what does it mean exactly? Care transformation is redefining the way consumers buy and use healthcare by developing new products, treatments, and business models that integrate separate healthcare organizations or activities. MedAxiom understands that moving the needle in CV care is not simple. It takes vision and leadership, and it requires bridging technology, innovation, and care delivery. MedAxiom experts are helping programs across the country shape the future of cardiovascular care delivery. Through education, organizational performance solutions, and advocacy, we are evolving disease management, innovating virtual care, driving the data revolution, and redefining access and team-based care. Let's transform cardiovascular care together. Get started at medaxiom.com/care transformation. Welcome back. We've been talking with Cathie Biga about her leadership journey and experience as ACC president. And we really want to dive deeper into really who you are and the impact that you've had on the industry. Earlier in our conversation, you talked about 40 years ago, women were teachers and nurses, and you just had a different vision, and your dad as well. As a woman in this groundbreaking leadership role you're currently in, what message do you have for other women and non-physicians aspiring to be in leadership positions in cardiovascular care?
That's an interesting question, and I probably have to answer it with a retrospective perspective, because when you're walking that journey, and let me remind people, your journey is not a straight line. It's going to have hills and valleys, peaks and valleys. But I think there's a couple key components. Number one is never say no, but never say yes unless you can deliver. And I think that's an important element for those of us that are looking at leadership in a different way, or trying to, as the proverbial saying goes, break through that glass ceiling. I remember when I became that hospital CEO, I think I was the first one in Chicago, or if not, there were like, two of us that were in that role. And people would always ask me, well, how did you break through that glass ceiling? And I remind them that you don't always have to break through that glass ceiling. Oftentimes it requires you to go around that ceiling,
Right.
maybe head up the stairwell, because you'll still get to that upper floor, but you may get there in an unconventional way or in a different way. So I think it's important for us to understand that adaptability that we talked about. So when we're adapting to our environment, whatever it is, that sometimes the path of least resistance is going around and
Right.
not necessarily, heading through it. So I think that's an important message, especially for our young female leaders in cardiology. We still struggle with ensuring that cardiology is a good field for women, making sure that the opportunities are well balanced, and making sure that we recognize those variabilities that are within our organizations and such. So I think that's probably the key thing, and to come outside your comfort zone. When I tell people that I'm an introvert, no matter how many times I take Myers-Briggs, I'm an introvert, and they're like, no, you're not. No, you're not. Well, yeah, I think you just have to realize, and we talk about leadership all the time with self-awareness. And that's probably another critical message for our audience today, is really make sure that you understand who you are.
Right.
Because otherwise you can't really be a good leader if you don't. We're not perfect, and we have to accept that within ourselves. I remember when I was a critical care nurse, all I wanted to do was, back then they were called charge nurses. I thought that was kind of cool. You kind of direct things, you get to tell people
In
what to
charge,
do.
yeah.
Yeah, kind of cool, in charge. But then you realize that with that power comes that responsibility. And so you have to be willing to accept that responsibility, that it's not just all about the power. It really is about being responsible for others, and not necessarily being in charge, but really driving to a vision in a collaborative way, making sure that we're really listening to everybody that's on our team, and acting in a way that is good for the team. Maybe not good for you individually, but I think we all will find out that if we work for the betterment of everybody on our team, it will probably be better for you as well.
Very true. Very true. Great, great words for everyone in this country right now. Let's think about how organizations like the ACC and MedAxiom can continue to support equity in healthcare leadership, because as you continue to keep saying, I mean, it is a team and you can't walk this journey alone.
So I think, and this is the message that I've been trying to deliver for a little bit now, is we have to understand what our true north is. It's not just talk, it's walking that talk. And so if our true north is really what we say it is, which is in inclusivity, it's diversity, it's equity, it's really making sure that not only our care teams are diverse, but that we can really take care of our patients. We have so many different cultures, so many different habits and lifestyles, that it is critical that we embrace that and modify our treatment plans to ensure that we are meeting the patients where they are, not where we would like them to be, but where they are, so we can get them to where we want to be. So that true north, I think, becomes it becomes important, but it really is important, because if we just talk it and we don't live it, no matter what that environment is, I'll take us right back to what we talked about just a little bit ago. We can't control the environment. Those things are going to happen, but we can ensure that we are living what we preach and what we believe in. And I think We'll see that at ACC 25. We'll see that in everything we do, that inclusion is important. And that includes inclusion in leadership. And I think I even mentioned that in my convocation speech, because sometimes we forget. We forget the different work environments that people are in. But the fact that I'm the first non-physician president, I think reflects the real values of ACC, that it really was something that they would be willing to see how it unfolds. And I'd like to believe that that is a legacy that we can leave for all those who are coming after us, because that's what it's all about. It's all about making that environment a positive one for the people that are coming after us, so that they can make it better and everybody makes it a little bit better.
Mhm.
And that will make life as we know it what we want it to be, which is inclusive.
Right. And people are watching, and we don't do what you say, someone takes a note of that and holds you accountable for it at some point.
And I think that you
Mhm.
mentioned that point, which I think you never want to think of yourself as having a legacy or thinking that you're, a cool person or anything. We forget the impact our leaders have on people. And I would just like to recognize those individuals that have come up to me and either told me or expressed in the written word that impact that you have, that is very difficult to accept as a leader. You just don't, it's hard to accept it. But when you get a note, I was in California, I'll never forget this as long as I live, and somebody just thanked me for my talk and slid a note into my briefcase that I read when I got back to my room. It
Mhm.
was so heartwarming. I mean, she changed her career based
Oh,
on things that she was hearing, and she was so happy. So we can't forget that that little girl that's in high school or is in the early part of their career, when they realize that somebody has got their back,
yeah.
how important that really is.
And that's one letter that you received. Imagine how many lives you touched that you'll never ever hear from. So it is.
Only hope.
Yeah, I mean, I see people all the time at our conventions and they say your name. They really do. I think, which is really special. Our ACC president, big job, very serious. But what would you say has been maybe an unexpected or humorous moment that you've experienced while juggling these responsibilities? Maybe traveling, since I mean you travel all over the world. So not sure. What's a good story?
Well, it's funny. So ACC was asking me, give us something funny. I said, oh, like sitting on the plane and your air tag goes off, that your suitcase is sitting back there in San Francisco while you're weaning your way to Singapore.
Ooh, oh
So
no.
I do encourage everybody to use air tags, at least it's, you'll know where your luggage is. It may not be where you want it to be, but you'll know where it certainly is. So, and you've got to find the levity and all of that. You can't take yourself too seriously. But I will, probably not humorous, but one of the things that has just warmed my heart is the incredible international embracing of this role, and the fact that I'm a non-physician, talking with the nurses in Saudi Arabia, talking with the nurses in Brazil and in Ireland, really identifying with them and where they're at in their struggles and in their world. And Saudi probably will sit with me for a long time, because Saudi is a different world for women. And as they are evolving in their culture, they asked me to talk about ethical dilemmas for nursing. Fascinating. It was just absolutely fascinating and heartwarming to see them struggle with where they want to go for their patients, to be their patient advocates in an area and in a culture that is evolving. So I think it behooves us in the United States to, again, remember how incredibly fortunate we are. We have, in spite of the fact that we still have access issues, we still have equitable access issues, we still have one of the most remarkable healthcare systems. And I think we need to embrace that. We need to fix the things that are broke, but we need to remember how very lucky we are with the healthcare delivery that is usually available to us, while we fix some of the hurdles that we have and some of the barriers that we have.
Let me ask you, because I feel like that's a story that you might not have gotten if you weren't a non-physician, if you weren't a woman, being able to connect with those women. And a lot of women suffer kind of from this imposter syndrome. So I do wonder, as you took on this role, is that something you struggle with, or is it something you didn't, yeah, just in general, what are your thoughts on that?
Yeah, that's a interesting and difficult question, kind of all at once. And it's probably a soul-bearing question if you sort of think about it, because I do encourage people to understand what their secret sauce is and not to have that imposter syndrome. So it might be sort of weird for me to say I'm not sure I really had an imposter syndrome, because when I was on this journey, and remember, many people sort of plan their presidential track in the college early in their career. It's just something they aspire to. You have to remember, I never thought that was possible. I thought it was impossible. And so I'll never forget in March, when I asked the very first person if they thought the college might be ready for a non-physician president. That was only 2 months before the deadline for submitting my application was.
Oh, wow.
So it was not a planned event necessarily, but I wondered if I could help make a difference. I wondered if I really could explain to all of those CB team members out there how important they were and how we really can't do this without them. And that working with our physicians, and same thing with our physicians, that having physician-led teams did not mean that they always had to lead. They could give that leadership to others in certain areas, and how much more powerful we would be as we lead together. And I think Chris Kramer, who's my vice president, has been just a phenomenal dyad leader, because I knew going into this, there were some things I could not do.
Yeah.
It's just the reality. And Chris was exceptional. Anything I needed from a clinical perspective, he would step up to. So I think it's a lesson to all of us to think outside that comfort zone and ask people you trust. Ask people you trust that it'll be honest with you, because that's how we grow.
And you knew that there was a need, and you saw there was an opportunity for growth that you could help with.
And my mom said that I could do anything I wanted to do.
Well, that
So
helps.
she's in that little voice in the back of the head that says, and you know what? If you don't try, you'll never know. So that's the thing I try to tell my kids and my grandkids all the time. You never know unless you try. You may fail, but it's okay. It is okay to not get where you want to go. Maybe hard, may hurt for a bit, but you'll be a little stronger on the other side of that. No, it'll be okay.
Yeah, a little more human too, for sure.
For sure.
Now, you've shared a lot of positive aspects and in this journey, but being ACC president, of course, has a lot of rewarding aspects. So what does this truly mean to you? What does this achievement mean to you personally?
Well, let me answer it from a non-personal perspective first. It to me, it means a lot that the physicians that chose me believed in me. And so that is enormously reaffirming. My day job physicians were phenomenal. They encouraged me to do what I thought was the impossible component. From a personal perspective, it's an amazing accomplishment that I just never really had anticipated. So when I say it's humbling, it really, really is humbling. There's probably no words. And it's funny, as I sort of get ready for the opening component, I remember Hadley Wilson saying that his year was magical. And I keep thinking, what has this year been? How do you describe it in one word? It's so very difficult to describe it in one word. It's sort of like an ecosystem. It's sort of like, this ebbing and this flowing that has just been transformative. And I hope it's been transformative for those that follow me. I hope I'm not the first and the last non-physician president. I'm hoping that we continue to build our leaders from our troops, and that in essence, both MedAxiom and ACC will benefit from being able to view things a little bit differently and trusting that it will be okay, and not listening to social media, because it's just noise.
Mm-hmm. Get off of it. Take a break.
Yeah, exactly.
Let me ask you this question as you begin to wrap up your presidency. Do you feel sadness? Do you feel relief? Is there just satisfaction? Are you hopeful? How are you feeling?
So it's very mixed. It's very interesting. It's an experience that was just so overwhelmingly positive and so personally and professionally enriching. that you just really can't put it into words, to be perfectly honest with you. Um, Satisfaction is an interesting word that you chose. I feel that there's so much more to do, but I suppose that's the good thing about what we do in the college, and a good thing about our presidential teams and how we sort of work in unison, so that there isn't a personal agenda, but there's also a consistent agenda. So I take my agenda of teamwork and quality, and I marry it with Chris's agenda of mentorship and innovation. And you sort of see a very common theme through that component. So as I hand the chain over to Chris, I know the college is in exceptional hands. I plan to stay active because there's so much work, yet to be done, and working with people whom I love. And besides, I have to fulfill my grandkids' prophecy that I really can't retire. I just pretend that I can retire, because I think there's just so many amazing things left to be done out there, because we're failing. We are failing to really fight this global burden of heart disease. We are not moving those numbers where we need to move them. And so I think there's so much work left to be done that I'm hoping that I can continue to contribute in that as I ride off into the sunset as a past president.
Yeah, wow. As the ACC celebrates its 75th anniversary, how do you envision the college's legacy evolving, and what do you hope your presidency will contribute to that legacy?
Yeah, I think the 75 years, and again, if you know the history of the college, as you may know the history of MedAxiom, you have to give it, because it is an organization. It's a consortium of individuals, but it is an organization that lives its vision. And you sort of watch the last 75 years. You watch from our very beginning. You watch from our physicians that had to break off and form the Association of Black Cardiologists because they weren't necessarily welcomed into the college. And you see that all change. You see that change as the CVT members were invited, and then the administrators were invited into the college. So you have to give those individuals that have come before us enormous credit for really not only reading the tea leaves, but reacting and changing where things need to be changed, making sure that we are the professional home for everybody. Same with MedAxiom, making sure that we have that home of non-clinical competencies that can really marry science and quality and operational efficiencies and financial stability, so that our healthcare system can continue to evolve. And so that legacy is really just that, is ensuring that CV team is part of that true north, that working with our physician leaders, embracing the team approach to everything is how we care for our patients, keeping those patients at the very center of everything that we do, and never forgetting for a minute that that's why we're all here, is for those patients, and ensuring that their CV teams help them in their, and I don't want to bring in the social determinants of health, but it just becomes so important to understand where our patients live, what their education is, how they have access or don't have access to cardiovascular care, and fixing that. The community days when I was up in Alaska, the ACC team flew into one of the remote villages to teach CPR to the boys and girls team. That's our legacy. Our legacy is our youngins. Our legacy is our junior high and our high school, and making sure that they live to see their grandparents live to see them grow up. And we do that by embedding healthy heart habits so that we can reduce that global burden. That's what I hope the legacy is, that we start to see those numbers trend where we need them to trend down.
Yeah, very meaningful. This conversation's been great, but it just scratched the surface, honestly. The Heart Talk with Cathie video series has been a unique collaboration between MedAxiom and the ACC. So listeners can watch all of those videos at the link in the episode notes. And also, Cathie, you will host your final episode live from the Heart to Heart stage at ACC 25. So Cathie, tell me, how do you feel the Heart Talk with Cathie series has shaped conversations about key topics within the ACC and MedAxiom community?
Well, and I'd like our audience to weigh in on that as well, too. I think we've covered some topics I wasn't all that comfortable with. I am out here talking about, Jack and some of the scientific elements that aren't necessarily my skill set. Dyad leadership, something that I felt so strongly about. I think the question is it meeting what our teams out there need? Is it been helpful to you? And if not, why not? And if so, how can we get that message to you in a better way? Tell us what you need that can help you and your teams, because it is all about your teams on the ground. It's when you walk in the office or you walk into your CV service line and you've got that mirage of brush fires burning. How can ACC and MedAxiom help you see through those fires, see the forest through the trees, for lack of a better word, and really help you on your day-to-day? That's what this is all about, is helping each other on our day-to-day journeys. It may lead somewhere incredibly wonderful, but it's really about that day-to-day journey and the impact we make on every single life that we touch, and how can we help with that. So I'm hoping that the diversity of topics that we covered helped individuals. I wish we could have reached more of them, to be perfectly honest. I always tell Kim and Candace, I want thousands of hits, not because it's me, but because I think it's a critical topic for our members. So how do we do that? How do we bring that energy that comes out of the MedAxiom meetings, that energy that comes from the pod sessions, and get that to everybody that delivers CV care? That to me would be a phenomenal true north for us to sort of work towards. So anxious to see what Chris does with it. I know, Melanie, you've been so great in leading a lot of the live sessions that we do post meetings. That's what really helps our teams get to where they want to go. So they've been fun to do. The team has been great to work with, but I'd really like to hear from the audience. What can we do to help your lives be easier?
I expected nothing less from you to say, let the audience weigh in, truly, what do they think? And I do think what we have to always remember is that when there's a video series and it's out there, people can watch it at their leisure. So we're hoping, more people will see it, and some things even on social media go viral years after they're posted. So Cathie, there's still time. You can go viral.
Oh, my grandkids would love it. They think it's so funny.
Oh, well, thank you so much for sharing your time and your expertise and really your personal stories and your heart today on MedAxiom Heart Talk. What a fitting time this is.
Melanie, it's been an honor and a privilege. MedAxiom, as people know, is my soul. So I appreciate all that ACC has afforded me in my years with them, and the partnership with MedAxiom has just sort of completed my heart and my soul. So thank you so much for leading me through this. You did a marvelous job. I hope I was able to achieve half of what you do. And to all of our listeners, thank you so very much. And I hope to see you in Chicago and in Orlando. So
All right. You made it easy, Cathie. You always do. Appreciate you.
thanks,
All
guys.
right. Well, that is going to do it for this episode. If you liked it, please tell your colleagues and let them know they can subscribe to MedAxiom Heart Talk on Apple, Spotify, Google, or wherever they get their podcast. Also, if you'd like to send us a note, we'd love to hear from you, or suggest a topic, email us at hearttalk@medaxiom.com. Thank you so much for listening.
Bye-bye.